Hi, my name is Nicole Lorig, and today I'll be presenting a study conducted by Maria Dickerson and Dr. Kim Cole called Factors Influencing Horse Heart Rate During Routine Hoof Care Procedures. Previous research suggests that routine healthcare procedures, such as grooming and transrectal palpation, may affect physiological responses, such as heart rate, among horses. A horse's response to potential stressors have been previously measured by evaluating changes in heart rate, behavior, and cortisol concentrations in blood, saliva, and fecal samples. One routine healthcare procedure performed on horses is hoof cleaning and trimming. Horses' hoofs are sensitive structures vital to their well-being, so this procedure is a key part of any comprehensive preventative healthcare program. This is an example of a routine hoof trim procedure. One individual is completing the hoof trimming procedure on a rear hoof while a handler is at the front of the horse near its head. There is little research available focusing on physiological responses of horses during routine healthcare procedures. Therefore, the objective of this study was to evaluate heart rate during routine hoof cleaning and trimming. The study used 27 American quarter horses housed at the Ohio State University Equine Facility, including 17 females, 3 intact males, and 7 castrated males. Ages ranged from 1 to 23 years. Heart rate was measured using the Polar H10 equine heart rate monitor, which was placed around the horse's heart girth behind the withers. This was in place during both the hoof cleaning and trimming procedures. To establish a baseline, heart rate first was measured prior to the start of each procedure. Heart rate was then recorded every 30 seconds during each hoof cleaning or trim. Results showed that average heart rate did increase from baseline during both procedures. Average baseline heart rate was about 51 beats per minute, and average heart rate for both procedures was above 55 beats per minute. Average heart rate differed for horses in different age groups. Horses between 1 and 2 years had the highest average heart rate during procedures compared to others. Then 2 to 3-year-old horses had a higher average heart rate than mature horses. Increased heart rate for younger horses is consistent with previous research showing that younger horses have an average higher baseline heart rate than mature horses. Additionally, mature horses are more accustomed to these procedures compared to younger horses, which may explain the difference. Results showed that horses' average heart rate increased from baseline when moved to a location different from their normal housing environment. Most of the horses in this sample were primarily housed in outdoor environments. Most horses are used to humans interacting with them from their left side. This study aimed to assess if starting a procedure on a particular hoof pair or individual hoof influenced heart rate. Hoof care procedures were first started on either both front, both rear, both left, or both right hoofs. It was found that heart rate did not differ between different pairs, but all pairs showed higher average heart rate than baseline. Average heart rate of horses did, however, differ according to the first hoof lifted. Though heart rate did not differ between either front hoof, lifting the left hind hoof first resulted in a higher average heart rate overall, and the right hind hoof first resulted in the lowest overall. Studies show that horses carry the majority of their weight on their front legs. This may explain any increased heart rate when either front hoof is lifted first. There were 2 primary horse handlers during the study, a male and a female. Results showed that average horse heart rate during hoof care differed depending on the handler, with heart rate averaging lower during procedures with a female handler. No studies have shown horse preferences for specific human gender, but instead have shown that horses respond differently to specific body postures. This may explain the differences in heart rate for these horses between the different handlers. Overall, this research shows that external factors can influence horses' physiological responses to necessary healthcare procedures. Understanding these factors can allow for individualized approaches for care and management to benefit each horse and improve their overall welfare.